Dr. Tayo Ajiro-Tutu, PhD, a clinical psychologist. He heads the clinical psychology department. He's a teacher, and many psychology students have passed through him too. He too has over 23 years contributed his own quota to the management of in and out of the hospital. Our moderator today is Mrs. Oluwakemi Akintoyeshe, a clinical psychologist and a foundation member of Yaba Voice. I implore you all to take a seat and listen to our teachers while I hand over to Kemi to moderate the event. God bless you all.
Thank you so much.
That was a very, very
You're all welcome once again. It's an honor to have you on this platform, the first of the webinar of Yaba Voice. The speakers have been introduced to us, and so we would go on shortly to talking about the discussion of the topic of the day. We are looking at mental health and stress management, navigating the new norm and emerging stronger. It's no longer news that the world is under a siege, and then we need to be able to adapt to that. To do justice to that, today we have Dr. Weye and Dr. Ajiro-Tutu. But please kindly note that comments and questions should be taken in the chat box. So if you have any comments or you have any question, please just state it in the chat box, and then we will get to it as we go on in this discussion. We're going back to Dr. Weye, who is going to give us his view on this topic that we are considering today. Dr. Weye, you're welcome, sir.
Thank you very much, Kemi. This morning, we are talking about mental health and stress management, navigating the new normal and emerging stronger from COVID-19. And for me to address this topic, we will look at some salient areas through which we can really get an understanding of stress-related COVID-19. We are going to look at health, the mental health, the COVID-19 related stress, and what to do in order to maintain a good mental health during this period and emerging stronger. Now we take it one after the other about health. Health stands on 3 tripods, according to the World Health Organization. It said it's a complete state of physical, mental, and social well-being of an individual, and not just the absence of disease or infirmity. Meaning that without mental health, there is no health. So mental health is very, very important for us to be able to even know whether we are physically okay or not, or whether we are socially okay or not. So our focus this morning is going to be on mental or emotional aspects of health. Now, before we go into the stress-related aspect of the COVID-19, what do we understand by mental health? Again, according to the World Health Organization, it's a state of well-being in which every individual can carry out 4 important roles. Number 1 is that potential, and make the best use of this potential. That is number 1 thing for you to know that you are mentally healthy. The individual must also be able to cope with normal stress of life that occurs on daily basis, be it at home, at work, or in the community. Not that alone, the person must be able to work productively, must be able to really work, must be able to function either at home, in the community, or if a student in the school. And the person must also be able to participate meaningfully in the community, contributing his own quota to the community at large. Once an individual is able to really carry out these 4 roles effectively, the person is said to be mentally stable. Now, what is the relationship between COVID-19 and the brain or the central nervous system? I want you to have some background information. For example, on March 2020, coronavirus was declared a pandemic, and this was carried on all the social media, and some people were asking, what is the meaning of pandemic? By mid-May of year 2020, COVID-19 had claimed more than 316,000 lives, and a lot of people were aware of this, a large number of people that died. And not that alone, approximately over a third of hospitalized patients experience some neurologic symptoms like dizziness, headache, loss of smell and taste, and sometimes impaired consciousness when the case is severe. And not that alone, coronavirus causes COVID-19, as we are all known. And we know that this virus is a beta virus, and that like other highly pathogenic viruses like SARS-1 and MERS coronavirus, we know that this virus is highly virulent. But there are two major ways in which this virus affects the central nervous system. The first one is direct invasion of the cells via the angiotensin converting enzyme 2 receptors. And we all know that these receptors are located on the epithelial cells of the respiratory tract or the gastrointestinal tract and certain areas of the brains. And they can get to the brain through various means. And not that alone, as you all know, that the transmission through the nasal cells will also cause some abnormal or loss of smell or taste. And another way in which it gets into this central nervous system is the immune injury via systemic inflammation, as we all know, which we otherwise refer to as cytokine storm syndrome. And all these contributes to psychiatric illness. But the one we are dealing with this morning is the psychological reaction to the coronavirus, to the pandemic itself. So various stressors related to COVID-19 may cause secretion of stress hormones like adrenaline and cortisol from the adrenal glands. And these tend to have their own effect on various organs in the body. Now, the question will now be, how does this now cause stress? Now, COVID-19 pandemic is associated with a lot of life events and some informations. For example, negative information from the social media, like the number of cases on daily basis. These tend to put people under stress. Some social media may even misinformed, and this may be a source of stress. The social isolation and the stigma associated with COVID-19 is another issue. A lot of people in isolation center, and those at home are not able to see them. This tend to create stressors on the family members as well as those people who are even in the isolation center. What about the lockdown? A lot of people are at home, family, children, mother, father, they are all at home together in a confined environment. All these tend to create stressors on them. The virulence nature of this infection is another stress, because a lot of people didn't know how they can even, the possibility of contacting this condition is also there, because the thing spread rapidly. And then lack of specific treatment. A lot of people get this information that up till now we've not been able to discover the appropriate treatment. Vaccine is yet to be developed. All these create the stressors in the life of the individual. Then the increased online exposure to the, most especially those who are at home. People surf on the internet and they look for information, and all these tend to really create stressors on them when they get negative information on the social media. Anxiety and fear over uncertainties. For example, the uncertainty over their job. Some people have lost job, and some people health conditions are also impaired, and they have difficulty in accessing the care. Some have problems with their businesses and the money. Some people's salary have been slashed, and all these things tend to cause problems. Then the worsening isolation in already isolated at-risk people. And this is another problem because there are no distractions at home. All these people tend to experience distressing thoughts. What about the bereavement and possible abnormal grief if someone close to the person dies during the period? Some people, the costs were not released to the family members. They are not able to grieve appropriately. All this creates a kind of stress on the family member. Potential increase in exposure to domestic violence as a result of the lockdown is another stressor too. And substance abuse too as a coping strategy in this individual. Then for the children at home now, also because they go online too frequently, there is possibility of social media addiction and bullying on the social media. And all these tend to create stressors on the individual affected. Now, what are the effects of this on the mental health of an individual? Number one, there might be sleep changes as a result of these disturbing informations that one is getting on COVID-19. Also, there is disruption of exercise regime and increased weight in the individual so affected because what happened? They cannot exercise as usual. Then also worsening of obsessive compulsive symptoms, especially if jam related. People are to really wash their hands frequently. I think at this point, I would like to stop and then others will be able to take over from this level. Thank you.
Thank you so much, Dr. Way. That was very, very detailed. He had talked to us about the definition of health and mental health and some of the core signs that you will see that will make you to know that you have a stable mental health, as well as the relationship between COVID-19 and stress in itself. And that is the core of why we are here this afternoon. So begin to look at some of those signs and see how we can manage better. Also, to do justice to this is Dr. Ajiro Tutu. He's going to talk from his own perspective about mental health and stress and how to navigate. But please remember that you can put your questions and comments in the chat box. As we go on in the course of this discussion, we will be attending to them. Thank you so much for being here.
Okay, good afternoon once again. It's good to be here. Thank you for the opportunity to be part of this and also to discuss the issue at hand. Well, like we know, the coronavirus has taken a lot of toll in our lives, and the outbreak has caused our lives, our world to change in so many ways. Did we actually prepare for this? I would say no. Worldwide, we didn't actually prepare for this. And this caught us unaware, and what do? We have to move on with our lives. It has generated a lot of stress in our lives, a lot of worries, sadness, boredom, loneliness, frustration, anxiety, and also depression. How do we deal with these issues? We'll look at some common mental health challenges, which we'll talk about. These issues has actually built a lot around us and how we're able to manage ourselves during this period. Well, Dr. Oya has actually shed light on mental health issues, how it has affected our function and all that. But I want us to look at some certain areas which has to do with how to cope and what are the major challenges that we have experienced. The fear of coronavirus has actually restricted our lifestyle in so many ways. It has brought uncertainty to our lives in so many ways. And also, are we equipped with the skills to cope with this serious issue at hand? We also want to look at the marital conflicts that we've witnessed via social media, even presentations and different settings between spouses because of the lockdown. A lot of issues are asking for questions. Then the issue of loneliness also and lack of human contact, which is what is happening now. You can't hug your brothers, you can't hug your sisters, you can't hug your cousins, if you can't shake your colleagues at work now. So it's a new thing in our life, which has affected so many things. Then also look at the working conditions now. It has been modified in so many ways. Well, people like us that work in the hospital, we have no options. But outside there, a lot of organizations have devised so many means to curtail the spread and also safety measures from people contacting this condition. There are so many emotional distress symptoms which has emerged from COVID-19. We've witnessed anger, we've seen irritability, restlessness, and all that. We've seen people have had difficulty sleeping. We've seen people who have had problems coping with the situation and also making unnecessary and bad decisions, which has affected them in several ways. What does this lead to? It leads to the question is, how do we thrive? How do we deal with this issue? And that is where we are right here, right now. We are talking about the new normal, accepting the change. With the pandemic, a change has come to the way for us to operate. And some of these changes include the laid down guidelines, which has been given to us. We talk about physical distancing. We call it social distancing, but we could also look at it from physical distancing, whereby we have to have a distance between ourselves physically. And the level of interaction has reduced with this increased need for social distancing as a result of the pandemic. There are also no more handshakes, no more relationship with people, even during empathetic or sympathetic period. So this contact has actually reduced so much. You also want to look at another major issue with this new normal, is our work schedule, which I talked about, and even another one is hand washing. We have to wash our hands regularly. We have to be hygienic and all that, which takes toll on us. Some people have actually even developed some other conditions due to this new normal. Then the use of nose mask, which is very discomforting. That is why you see a lot of people pulling it down from their nose. For example, it's so discomforting to me as well, but I have to make use of it to be safe and also to keep up other people safe. So this new norm has taken a major toll. It has affected our religious life too. It has affected our religious life too. We're not attending churches, we're not attending mosques. It has affected that area. And another one, despite all the issues at hand, which Nigerians enjoy most, is our social events. And for the past five going to 6 months now, we've not been socializing. No marriage, no birthday parties, even burial ceremonies have been so challenging. So it has, and those are some of the avenues that people use to get away from stress. And even going to watch cinemas and all that, it has been put on hold. So and we are coming to terms with this new normal. So we have to take that into consideration, that we need to accept this change to keep us safe and also help others. So how do we navigate during this period? What are the things that we expected to do? How do we deal with this issue? Well, one, I'll give some tips on striking this balance, ways of coping, and also navigating through this pandemic so that we can emerge stronger. Life has to move on. We have to move on. Despite this condition, we have to accept this change, because you cannot say, most other countries have moved on. We know there's a problem, but we have to still maintain relationship. So considering how to connect with others, we have to still maintain relationship with people. We can reach out to our loved ones, family, friends, siblings, and all that through video calls, social media, telephone interaction, and all that. We still stay connected with that. So that's a very, very significant one. And we can also help others. We can also help others because our psychological makeup are quite different. Our strengths are quite different, and we talk about individual differences there. So we think about how you could be able to walk through this way and make things happen. Then also we talk about your worries, like we always say, repressed emotions will find its way out. So you have the chance to talk to people, talk to family members you trust, talk to colleagues you trust, and if it's out of that, you can seek professional help. Then you also look after your physical well-being as well. Dr. Oye broke that down, making clear difference between mental health and mental illness as well. And also have to take your physical well-being also into consideration. Then sleep is very, very pertinent, very, very important as well. Because during this COVID, a lot of people are presented with poor sleep based on fears, worries, anxiety, and all that, which could be linked to COVID-19. Then this is also a period that we should try to manage our difficult feelings. Many people find news about coronavirus concerning. However, some people may experience such intense anxiety that becomes a problem. So we should be able to manage our feelings during this period. Then we also look about our daily routine. How do we go about our daily routine? For people who have vehicles, you can drive in your vehicles, but for people who use public transport, they have difficulties. The issue of crowding, the issue of spacing, And even the transporters are not taking that into consideration. So those are some of the issues. Then another major is that we need to do things we enjoy doing. We have to still do that. Your favorite hobbies, learn some new things. Well, it has restricted our stay and a lot of things, but we still have to find pleasure in things that we enjoy doing in the past. Also set goals which are visible and keep your mind active as well. Now we are so restricted that after work, now you are going to your house, you go to visit somebody now, they are giving you sanitizer, they're telling you to wash your hands. That's enough factor for you to even stay in your house. So some people find it very embarrassing because everybody is a suspect. Everybody is a suspect. So people tend to just, so while you go home, there are so many things you can use this period to start looking into, which could develop you and make you do better. Then take time to relax and focus on the present issues. So I'll rest my thoughts here as we move on. Thank you very much.
Thank you so much, Dr. Ajura Tutu, for that wonderful insight that you had given us into this new normal. The definition of new normal is something that I hope you were able to get from his discussion. Social distancing, using of nose masks, we can't visit, we can't socialize. All of these are quite stressful to us. But then importantly, he said something, acceptance and the life has to move on. And so that means we have to find a way to deal with all of this, to be able to persevere in the midst of all those challenges that we're finding ourselves. But then again, we want to go back to Dr. Weyer to ask him, are there certain medical conditions that we would likely observe so that we can begin to manage ourselves? And when people begin to see, maybe we begin to see all of this, we will be able to know that these are related to the COVID. Are there certain mental health conditions that are peculiar with this particular period, sir?
Thank you very much, Kemi. I so much appreciate you for that. Like as I said, there are things you see in an individual to show that, oh, actually this individual is experiencing COVID-19 related stress. First of it is what we call the worried well. Those people, they don't have COVID-19, but they experience imaginary symptoms of COVID-19. For example, you will see them, they will be coughing, whereas there is nothing that warrants the cough. They visit doctors, and they are just worried about their health generally. And when they go to the doctor, they do find nothing in them, and they are not COVID-19 related. There are a lot of people like this who are not able to sleep at night. They are fearful, and they are afraid of contacting the disease. Not that alone, there are some people who develop anxiety disorder related to this pandemic because they don't know how soon or how they contact the disease and what will be the outcome if they should have it. So that's another thing that we should take note. Some people will develop depressive disorders of various magnitude, either mild, moderate, or severe as a result of this, because a lot of people locked down at home. There are no distractions for them from distressing thoughts. Before you know it, they develop depression. There are some people who develop obsessive compulsive disorders in the process. And you see them washing hands repeatedly, and they become distressed once they have not done this. So a lot of conditions. Some people will even go into what we call substance use disorders of various magnitude. So these are some of the manifestations of these stress-related conditions, and a lot more when you talk about COVID-19. So Kemi.
All right, thank you, sir. he had been able to shed light into some of these common medical or mental health conditions that are likely to be more prominent at this point in time. But then I want to ask Dr. Jirotutu, are there ineffective ways or coping techniques that people can adopt or resort to at this point in time? It's good that we let the public out there know so that they would understand that what they have been using is effective or ineffective. Thank you, Dr. Jirotutu.
Well, what are the independent coping techniques that people? Well, it depends on the problem. But before I go on, I want to say what is ineffective coping? What is ineffective coping? Ineffective coping is inability to really assess stressors and use available resources to cope with your stress. All these are ineffective coping are enormous. Ineffective coping
can result from any number of factors, including an accumulated day-to-day stress, which we go through, traumatic life changes, major injuries or illnesses, and also emotional trauma. So like I said, I was offline a bit. What is ineffective coping? Ineffective coping is the inability to realistically assess stressors and use available resources which an individual has to cope with his or her situation. Well, people use different negative coping ways to deal with problems. And one major one that we know as so much alcohol, the use of alcohol and substance abuse is one. That's the use of illicit substance abuse, abuse of prescription medication, unrestrained delay of feelings, deliberate self-harm in so many other ways, and also aggressive behavior as a way to ward off issues from people. And some people even have negative perception about themselves, criticizing themselves negatively. And once you have that, it tells you a lot about yourself. So we're talking about the way out and how to use positive coping skills, which will help you through this problem. And also violence at times could be directed towards others, like hitting someone, throwing things at people, and also kicking something. And it could even be eating too much or even little and having problems with the use of some other substances. Thank you, Kevin.
All right, thank you, Dr. Jirotutu. He had just highlighted to us some of the ineffective coping skills that people adopt, especially in times of pandemic and stress. Okay, so we will go shortly to Dr. Ware, and then we'll be asking, looking at this new normal, does it have any implication on children? I know you mentioned the fact that online lessons are also things like that, but parents who are here would also be able to understand that does it also have any mental implication or psychological implication on their children too?
Thank you very much, Kemi, for the questions. There are various mental health implications from this COVID-19, most especially for the young ones, because you see a lot of children at home now being locked up with their parents. Like as I said earlier, most of these children, you see them engaging in all various forms of social media activities. Some may be exposed to bullying via the social media. This is a possibility. And apart from that, because they are continuously at home, they may also have what we call internet addiction. Because you see, some of them will just be online 24 hours. And because of this, again, you can see that some of them may engage in excessive eating and the associated complications from it. Some because they are not allowed to interact with their friends, because they are isolated from them. You see all sorts of abnormal reaction from them. You see them, some of them throwing tantrum at home. So these are some of the things that you can see in the children at home. In addition to the other conditions like depression in children, which may manifest in various forms in them. Anxiety also about the possibility of when they are going to go back to school. So they may become so anxious. And some of them, because of this now, they may not even be interested in going back to school. These are the issues that we may encounter during this period. And as parents, there are some things we may need to do to be able to really help this individual. Thank you, the moderator.
Thank you so much, sir. So you can also see that what we are going through does not affect all the ones alone, but it also has implication on the children. And so we must be able to understand. Yes, it's also part of the new, and what are the things that we can do to help people working at home, especially in times like this? Thank you, sir.
Okay, well, it's one of the issues I mentioned.
One of the issues I mentioned
earlier on, that it's a work or change our working at home by looking at work-life balance. Because I have to work at home, then you have to still do your normal life. So these are some tips to help achieve work-life balance while working remotely. One, now you don't have total control of the home. So you share the home with other people. So you have to set a structured work schedule in order to maximize your productivity and your work day while working remotely from home. It is important to set a schedule for yourself to guide you through the day. Also, given that working from home, it's more comfortable and a bit relaxing compared to when working at your normal office. So having a structure on your day will help limit distractions and keep you focused on the task ahead. And another important thing is you have to make a to-do list to start your day productively. There must be a to-do list to assess yourself, to see probably, does it actually what I've been doing? So your to-do list will help you to ensure that you have been productive, able to accomplish what needs to be done based on what you have listed out. Then physically, you cross-check or you take out things that you have done, the projects on your hand or your to-do list, and this can be gratifying when you see that, oh, the task you set ahead, you've been able to deal with it as it progresses. And also, you have to get grounded. Don't try not to roll out of bed and start working immediately. You have to do your normal things. You have to take your bath. You have to clean yourself up, eat, then also even meditate. If you are someone who meditates, you can do that. Then take time to arrange your work day as it starts and see as it progresses gradually. So just don't jump in front of the laptop and start working. Then also have to set boundaries because, we all live in different houses or different apartments, and some apartments might not be so spacious where you can have a whole room to yourself. So people you live with, either your spouse, children, siblings, and all that, you have to have a discussion with them. Hey, this period, that is going to be busy. Mom is going to be busy. I need 2 hours from you. I need 3 hours from you. This is my work area zone. So you can go and play there. I need this space so that this is where I have to bring money home. They are sacking people. It's so tight outside there. People are losing their jobs. So I have to meet my target. That's on a lighter note. So you have to set boundaries with the people you live with so that you can have your space to be able to do your work and send to the office, which is quite different from my own setting where I work with Dr. Where you have to be on ground. We work in the hospital. Then you also have to hit your stride. Develop a workspace within your home, like I said. Establish dedicated workspace for yourself within your home to help you create a consistent routine for what and time you want to be productive. And you also have to take breaks. You can't just be there from morning till evening. You take a break, you could take a break for 10 to 15 minutes, take a walk, go get a little thing to eat, snack up and all that. Then come back and start doing your work. Then also, don't joke with your lunch, don't joke with your food. Don't joke with your lunch, joke with your food. Then also get yourself organized. So, and also, the transition out of grace doesn't mean that you just have to make sure you rush and do everything. Work with it very, very, and make the day beautiful for yourself after putting so much into the work. Thank you, my moderator.
All right, thank you so much, Dr. Ajira Tutu. He has given us wonderful tips on what to do, especially for those of us that are working from home in being able to go through this period. The technology has also helped us, but it's also one of the bad of this season, because if you are not careful, it will be frustrating. And so we just need to be able to pick up some of those tips, begin to balance your life, set priorities. All right, so Dr. Owaye, I have a question here for you, sir. I'm going to read it up from the chat box. It says, talking about skills, vis-a-vis coping skills during the pandemic, aside physical means drawn on as washing of hands, use of face masks, social distancing, perhaps you can throw some light on how learned optimism by Professor Selinger can help through this. He said, we'd love to learn the ABC approach to this. All right, sir. So Dr. Weyer will take this for us.
Thank you very much, the moderator. There are some things I want us to really understand about this COVID-19. History has shown that this kind of infection or pandemic has occurred in the past. And definitely, some people died and a lot of people survived it. So there is need for people to understand that this pandemic period will be over, whether we like it or not. So that understanding will enable you to know that there is future after this pandemic. So there is need for people to learn to be optimistic about the future. That is one thing that we really need to know. There is pandemic, it has come, it will definitely go, because no matter how difficult it may be, it must have an expiry date. So having that understanding with us will now make us to now employ some social skills, which could be of help to us, most especially whenever we have anxiety-related condition, like the person asked here. For example, you can use relaxation techniques, which is so simple that everybody could do. All you just need to do is just to put your hand on your tummy, okay? Breathe in for 4 minutes, hold it for another 4 minutes, and then gently exhale it for another 6 minutes. By the time you do it in a cycle of about 10 to 15 times, you discover that you get some kind of relief from those anxiety conditions, which is just a simple do-it-yourself relaxation techniques that the psychologists make use of from time to time. But definitely, if you look at it from the ABC point of view, there is need for you to know the antecedent, which is the presence of this pandemic. And your belief about this pandemic, you must try as much as possible to note that and believe that this pandemic has come and it must go. Once you have that belief, then you will be able to pattern your life accordingly. So there is need for you to really learn a lot of things during this period. And apart from that, there are also some other things that you can do to be able to emerge stronger. You can talk to someone or share your difficulties with others. You can call a person just to share your experiences with that person. And you can watch movies at home to create distractions from all this pandemic. You can play family games together at home. This will go a long way to really help you. And not that alone, you can also see this opportunity of lockdown at home as a time to bond with your children and the member of the family. For those of us who have elderly ones at home, you can call your elderly family member who may be living or feeling alone to keep in touch with them and to be able to reassure them during this period. You can also try music therapy. And the most important of it is to employ virtual communication with your therapist. And this you can do by making use of our online contacts of the psychological experts in the hospital that you can call at your own leisure hours and talk with them about your experiences, and all the things that we are not able to discuss this time, we'll be able to discuss with you. Thank you.
All right, thank you so much, Dr. Weye. He had also shared with us lots of tips and things that we can use at this time. But there's also a question here, Dr. Ajiro Tutu. I want us to take that. What are the recommended self-help tips? I am sure that that's exactly what Dr. Weye has asked now. So the other question I'm going to ask you is, what are the positive coping skills? It's also in the chat box. What are the positive coping skills that we can adopt? I think this individual just wants it specifically. Maybe just highlight it 1, 2, 3 so that they can understand it.
Okay, like the coping skills are so much, and we just want to look at a little bit of it. One of the major ones is the issue of speculation, which people hear different things going on and all that. So rumors and speculation can fuel anxiety. So having access to good quality information about this pandemic can help you feel more in control. You can also talk about your problems openly with someone, like Dr. Oye just talked about that, sharing your experiences with someone who can help you walk through this phase. And some people might feel that talking about their depression, anxiety, and all during this period, they should be encouraged to talk about their feelings. So it's good for you to talk about your feelings. There are so many support helplines which are available, like you said. And also, very much important, you can share your views with your family members and so. And also tell yourself some positive things about coping, because right now there are some things you cannot change. We are not in total control. So the issue of coping and being able to adapt to the situation is what is paramount now. So you tell yourself positive things, and once you're able to tell yourself something, it could help you walk through this phase. And also identify and learn to manage your triggers. Those triggers are so important. Sometimes they can be obvious, some are not obvious at times. So when you do figure out your triggers, you should be able to try to limit your exposure to it. And if you can't limit it, use other coping techniques which will be helpful. There are some that you might not be able to use, but those self-helps could be very, very important and can be useful. Thank you very much, moderator.
All right, thank you, sir. There is a comment here from yesterday, Odejai, who says, please, if care is not taken fast, the various social medium can turn out to be toxic and pandemic, especially among our youth. What can we do to help, please? Mental health of many are negatively affected. Depression, so many among us. What can we do? Dr. Weye, what can we do?
Thank you very much. Thank you very much.
In this type, what can we really do in this type of situation in which you have children being exposed to toxic information they are getting from the social media? As parents, we have a role to play. And one of our roles is to control our words or our children on the use of the internet. This is very, very important. As parents at home, you must moderate the type of information and the information the children get on the internet. Also, we as adults, we have to really be careful of the various information that we get from the internet. So not all the information from the internet are actually true. So some of them are just misinformation. So please moderate the use of internet with your children. That is number one thing that you need to do. Also create distractions for the children. Okay? Create time for them for exercises at home. This may be done in houses where there are courtyards at the back. You can create time for them to exercise and create distraction for them. You can take them for a walk and bring them back. So these are some of the things you can actually do to distract them from all this toxic information that is available on the internet at home. So the moderator.
All right, thank you, sir. He had said, let's moderate the use of the social media. I know it's a huge challenge, especially now that the children are locked down at home and they cannot even do so many. And let's moderation from them. Thank you so much, Dr. Weyer, for attending this question for us. There's a question from Dr. Adegba. You mentioned challenges of working from home. I am sure that Dr. Ajirotutu addressed that earlier, but in quick minutes, please, can you, Dr. Ajirotutu, can you just give us some of these clicks again? What are those mental health challenges from working or psychological issues that emanate from working at home?
Okay, well, there are so many issues which which we've been able to identify that have been a causal factor leading to mental challenges and even conflicts at home. One, we talked about the cabin fever. The lockdown itself is an issue where your movement is being deprived. Things you used to do, you are not able to move freely, time are restricted at all. So you are compacted at home. And even it generates a lot of conflicts, even within the home. Probably we've seen so many issues among spouse and there. And it even depends on the individual in question. If he's living alone, it's another factor. For people living together, they have one or two people to talk to. But for one living alone, it brings out the issue of loneliness. It brings out the issue of boredom, even despite working. So in order, because of the boredom and loneliness, that individual will engage more, doing so much on the work and spending less time because they have nothing to do. Probably watches TV and go back. So that's one of the major challenges. And if you could, that I rolled out so many tips on how to cope, on how to manage this situation. And in a situation like that, whereby we've seen so many people who have even broken down during this period, out of boredom, out of loneliness, and even the psyche alone just being plugged down in the house. Because even now, you can't go to work. You have some certain organizations are not allowing their staff to come to work. And you can't go visit people. Everywhere you go, you are a suspect. So people tend to spend so much time at home, which is also a factor. And if you recall, I've read out the tips which will help an individual function without area. But by and large, a person can always reach out to people via telephone, via WhatsApp and all that, video calls and all that. That would be a way to help that individual cope. Thank you.
All right, thank you so much, sir. So tips have been given on how people working at home can cope, especially when they're having frustration, irritability, and quite a lot of other symptoms that have to do with mental health or psychological issues. All right, another question just came in from Yaba, and that is what's the negative impact of the lockdown on the mental ability of our children? I am sure maybe you weren't here when Dr. Weyer did justice to that, but in 1 minute, sir, could you just take it again so that we know that we have actually impacted people before leaving this platform today?
Thank you very much, moderator. The negative impact of this COVID period on the children, for example, because the space, there is confinement of space, they are bound to be violence, fighting, misunderstanding among the children at home. This is very, very important. And as a parent, you must take note of it. 2 is excessive eating. This one can also occur when the children are in the confinement and the foods are available, they continue to eat and eat and eat, and too much of everything is bad. Not that alone, once there is what we call availability of this social media, you discover that some children can play games from morning till night. They can surf from morning to night. all this area, we as parents, we must be able to really take care of this. And because of this isolation, there are bound to be some degree of stress on the children too. They may develop some mental illness like anxiety because they don't really know why they are confined at home. They are just hearing about COVID-19. They don't know what it entails. So this is one thing that we must take note of. Some may even develop depression. Some, because the space is limited, they may throw temper tantrums. So all these things may occur in children who are under lockdown. And we as parents, we must watch out for this and be able to do something on it. Thank you.
All right, thank you so much, sir. Dr. Chirotito, please, just in 1 minute, please, can you just help us to understand what's the correlation between this lockdown, the pandemic, and the increase in the rate of rape and sexual addiction or sexual abuse that we are seeing in our world today? Please, in 1 minute, sir.
Okay, thank you, Kevin. Well, linking rape and sexual abuse to pandemic. Well, we'll first pick it from the lockdown. The lockdown has created an avenue for people to stay at home. And in neighborhoods, a lot of things have been happening which were so visible. So the lockdown had a negative effect in that area. Although yes, rape has been it has been on for years, for generations, and all that. But it became so rampant during this lockdown. And like we always say, the mindset of people made them to react and behave in so many ways. And like you could see, the constant rape coming in and domestic violence as well. Where for spouse alone, the time of going to work, when we go to work, we give ourselves space, we turn to other people, that we come home, we stay released. But this period, based on frustration, anger, and all that, a lot of spouses, we saw them got into fights. It was all everywhere in social media. They will fight, they will come out and all that. People would intervene and all that. Even in neighborhood. So the lockdown had so many, apart from the virus itself, it created so many issues, conflictual issues among spouses, the issue of rape, domestic violence, and all that. So that lockdown, the deprivation of movement, the crowding, the movement in the neighborhood exposed a lot of people to those dangers and made them available for people to take advantage of them or people to actually perpetrate the act of rape. So the lockdown had a very, very major, is a contributing factor to linking the rape issue and also domestic violence to the cause of the pandemic. Thank you.
All right, thank you so much, sir. We have been having a wonderful time today. And thank you, Patrick. All your questions and comments are recognized, and we appreciate it for coming in. Addiction about phone use and internet control has been taken by Dr. Weye, and he has said minimize the use as well as distract. And so when you're able to minimize the children from using and able to distract them, then it helps us to be able to minimize addiction to it. But I'm going to come back to Dr. Weye, and the question here is for parents who shout on their children because of maybe their own frustration or the stress that they are going through, what advice or what do we tell those parents today, sir? Dr. Weye.
Thank you very much. Thank you very much.
We appreciate you, moderator, for those people who shout on their parents. Shout on their children. Now, there are some things I want us to note that whether we like it or not, children will exhibit certain behavior which we may not really like or which we may not want to tolerate. And actually, for you to be able to correct children's behavior, it's not too shouty. Behavior can be corrected through various means. First on the list is by rewarding the desired behavior. You bring the behavior that is not good to the fore for the children to know and take note of it. After taking note of it, you now let the children know that behavior like this is wrong and it's not welcome in this family. And once you do like this, you are likely to be rewarded. there is you can make use of the concept of token economy to be able to do this. That over a period of time, when you sustain this behavior that is desired, this will be given to you. This is one way of correcting children, rather than shouting and shouting and shouting. All you just need to do is to bring this to the fore for the children to note about it, and then let him also have information about the bizarre behavior, and let him know the consequences of both behaviors, and then what you need to do for that child. Thank you.
Thank you, Dr. Weye. Bring the behavior to the fore, talk to the child about it, correct it, rather than shout on the child, because you're also adding to the mental health challenge that the child might also be going through if you shout. All right, so in 1 minute or half minute, I'm going to ask Dr. Weye to just give us his final word on this topic of discussion today.
Thank you very much, moderator, for giving me the opportunity once more. Now this morning, we have discussed, or this afternoon, we have discussed about mental health, COVID-19 related stress, and how to emerge stronger after this period. One thing I want us to take home is that whether we like it or not, people will react negatively to this pandemic. Some may not even develop the infection at all, but they will also have, start exhibiting the symptoms. Some may not be able to sleep well. Some may have some anxiety. Some may have depression. But one thing that is certain, because this is the essence of this social media platform, once you are in distress psychologically, call your experts. And that is why we have the Yaba voice that you can contact 24/7. Before we leave this platform now, this will be relayed on this platform, which is very, very important. That's one take home I want you to take note of. Secondly, there is another thing for you to be able to, for you to go on with. This period will be over, whether we like it or not. So be optimistic about this COVID-19 pandemic.
Thank you so much, Dr. Weye. Final word is, please be optimistic. This period too will be over. So we have to navigate and go through. Dr. Ajiro, please, final word in half a second, please.
Okay. Well, like Dr. Weye said, I'm an advocate of accepting the change. Accepting the change, and we have to come to terms with it that what we did in February 2020, we can't do it anymore. We stopped doing it by ending of March 2020. It's a change we have to accept. We have to move on with our lives. We have to adapt. I also work with I represent the hospital working with the psychosocial pillar team. I've seen people come down. I've seen people come down with this virus. We've seen them go through pains. We've seen people got well, and we've recorded mortality as well. It is real. We have to follow the laid down guideline rules to prevent us from contacting this virus and from spreading as well. Despite that, our life has to move on. We have to, like I always say, our life is in a triangular form: our work life, our family life, and our religious life. For our religious life, we are not going to church, but we can make life out of what we have. Thank you very much.
All right, thank you so much, Dr. Neuro-Psychiatric. I know our speakers today are very loaded and the time allocated is not enough, but we want to appreciate every one of us for being on this platform. On behalf of the medical director, Dr. Osiogu, I would say thank you for being part of the first of the webinar of the Yaba Voice. Please, you can kindly follow and like us on Twitter. Just click on Yaba Voice, and also on Instagram, click on Yaba Voice. One word on Twitter, capital letter, Yaba Voice. And then if you would call, it will share that after a while to let you know on hotlines that you will be calling in. Please, if there has been any challenge or any mistake or anything that you don't feel comfortable about today, please just take it as our learning process and we will get better. In the next 2 weeks, we will also be having a webinar. The title is Substance Abuse and the Pandemic, the Intricacies and Solutions. We will share the details on our e-flyer to all those platforms and to everyone that has been here today. We will appreciate you for being here. Like again, I said, on behalf of the medical director and all the speakers and everybody, thank you for being on this platform today. Thank you to our speakers. Thank you, everyone. Hope to see you soon, but please accept that this time will soon pass and change is something that we must embrace, and we will keep moving on until we are able to achieve success and progress. And so we have to emerge. So keep safe. God bless you. Bye-bye.